Hello, my name is Bianca. I'm going to be your student nurse. I'm here to perform a quick health assessment on you. Is that okay? Okay, so first I would start off by practicing hand hygiene. I'd be washing my hands and donning my gloves. Can you go ahead and state your full name and date of birth for me, please?
My name is Elias Martin and my date of birth is 10/31/2002.
Okay, so I would just verify that his full name, date of birth, and MRN number on his wristband match what we have on record, which it does. Mr. Martin, are you allergic to any foods, medications,
No,
anything in the environment?
no,
How about tape,
no,
latex?
no.
Okay, thank you. So I would just verify in his chart and on his wristband that it says no allergies, which it does. Okay, Mr. Martin, I'm gonna go ahead and go over your vital signs, okay? Your blood pressure was 120/80, your heart rate was 80, your temperature was 97, oxygen saturation was 98%, your respiratory rate was 20, so everything's in normal range, okay? Are you having any pain?
Yeah.
Okay, when did the pain start?
Yesterday
Okay, and where's the pain located?
on my left knee.
Okay. And how long has the pain lasted?
How long? It's been constant,
And how would you describe the pain?
like needles,
What makes the pain feel worse?
walking,
And how about what makes it feel better?
ice,
What treatments have you tried?
Tylenol,
And on a scale from 0 to 10, 0 being no pain to 10 being the worst pain ever, how would you rate your pain right now?
6.
A 6? Okay. All right, thank you. So my patient has already stated his full name and date of birth. Mr. Martin, where are we at right now?
We're in the hospital.
Okay, what month are we in?
June,
And why are we here right now?
because of the pain.
Okay, thank you. So my patient is alert to person, place, and time. I don't see any signs of distress on my patient, and his body is symmetrical on both sides. So next I'm going to go ahead and evaluate to see if my patient has an oxygen apparatus. He does not, but if he did, I would assess it in the following way. First, I would ensure that it is placed properly, that it's comfortable for my patient, that there's no skin breakage surrounding any of the tubing, that the tubing has no kinks, and that the flow is not obstructed. I would also make sure that the flow rate matches what the prescriber had ordered. I would next make sure to see if my patient has an IV line. My patient does not, but if he did, I would assess it in the following way. I would make sure that it is placed properly, that there's no skin breakage surrounding the area, no kinks in the tubing, nothing obstructing the flow in the tubing, and that the flow rate matches what the prescriber had ordered. I would also make sure to palpate around the IV, ask if my patient has any tenderness, observe for any edema or erythema. Okay, and then next I would make sure to see if my patient has a urinary catheter. My patient does not, but if he did, I would assess it in the following way. I would first make sure that it is secured well to his leg, that it's properly placed, no skin breakage surrounding the area, no kinks in the tubing, that the flow is not obstructed, that the collection bag is in a stable place like the edge of the bed frame. I would also make sure to take any note of the urine color, consistency, and amounts. Okay, and next I'm going to go ahead and look at your hair if that's okay. Thank you. So his hair is even. I don't see any breakages, any rash, or any lesions. Thank you. My patient's skin tone is what is predicted for his ethnicity. And then in a clinical setting, I would make sure to ask him to pull up the sleeves or take off the shirt just so I can fully examine his skin. But I don't see any lesions, any bruising breakdown, any rashes, or any wounds. Are there any wounds that I do not see?
No.
Okay, well if there were any wounds present, I would make sure to take note of the appearance, the drainage, and the dressing. Okay, now I'm going to go ahead and evaluate his skin temperature. In a clinical setting, I would make sure to do this on bare skin. I'm just going to put my arm like this. Thank you. So his skin temperature is warm and skin tone is even. I'm going to go ahead and pinch the top of your hand real quick. Okay, elasticity is good and no tensing is present. And then I'll just take one of your thumbs. And then each toe. So his capillary refill is normal. It's less than 3 seconds on all 4 extremities. I don't observe any edema as well. So next I'm going to go ahead and evaluate his ears. So I don't see any drainage, any lesions, any skin breakage in his ears. Do you feel any kind of tenderness?
No.
Okay, so my patient states he has no tenderness and I don't feel any nodules. I'm going to go ahead and test for your eyes next, okay? If you can just go like this, look straight at my forehead, and I'm going to flash a light twice in each eye, okay? The other side. Thank you. You can go ahead and lower your hand and just keep an eye on my finger. Just follow it. Okay. So his pupils are equal, round, and reactive to light and accommodation. If you can just tilt your head back and lower your eyes like this, please. Okay, so his sclera is white, conjunctiva is clear and moist. And then if you can just tilt your head back, I'm going to take a look at your nose. Thank you. So his septum is midline. I don't see any lesions, skin breakage, and I don't see any lesions as well. Okay. And if you can just open your mouth and say, ah.
Ah.
Thank you. So his mucous mucosa is pink. I don't see any sores, lesions, or skin breakage. And his tongue was smooth and intact. If you can just give me a quick smile, please. Thank you. So his facial features are symmetrical. And then now I'm just going to make sure that my patient doesn't show any signs of respiratory distress, which he does not, and I don't see him using any kind of accessory muscles. So Mr. Martin, I'm going to go ahead and take a listen to your lungs, okay? Every time you feel my stethoscope on you, just make sure to give me a deep breath. If you start feeling dizzy, just let me know. We can always take a break, okay?
Okay.
So in a clinical setting, I would make sure to do this on bare skin. So all lung fields are clear. I don't hear any bronchi, wheezing, or any crackles. And I did see that his chest expansion was equal bilaterally. If he needed to use an incentive spirometer, I would make sure to teach him how to use it, ask him to demonstrate it for me, and then let him know to do it 10 times every hour. Okay, so next I'm going to go ahead and palpate his carotid artery. Rhythm and rate are equal bilaterally, and then I'm going to go ahead and check his radial pulses and pedal pulses. Okay, so the rate and rhythm is equal and even bilaterally. Next, I'm going to go ahead and palpate his PMI, which is located on the left fifth intercostal space on the midclavicular line. Okay, so I don't hear any lifts or heaving present. Next, I'm going to go ahead and listen to his carotid artery. rhythm and rate are equal and even. And then next I'm gonna go ahead and take a listen to all the fields of his heart. First, I'm gonna start off with the aortic area on the right side, the second intercostal space, right sternal border. Then I'm gonna listen to the pulmonary area on the second intercostal space, left sternal border. Then the Erb's point on the third intercostal space, left sternal border. Then the tricuspid area on the fourth intercostal space, left sternal border. And then lastly, the mitral space on the fifth intercostal space, mid-clavicular line. Okay. And then on in a clinical setting, I would make sure to do this on bare skin. And now I'm just going to listen to his PMI on the left mid-clavicular line on the fifth intercostal space. Okay, so in all heart fields, I do hear that the rate and rhythm is regular. I hear S1 and S2, and I don't hear any extra sounds. Mr. Martin, are you having any tingling, numbness, or any tenderness?
No.
No? Okay. So I'm going to just ask you to go ahead and give me your hands and push towards me. Okay. And then go ahead and resist my push, please. Thank you. And then go ahead and step on the gas for me. Thank you. So hands are equal in strength, feet are equal in strength. My patient has full range of motion against gravity and has full resistance. Thank you, Mr. Martin.